infectious disease usually caused by Mycobacterium tuberculosis. It commonly affects the lungs. So what is the radiographic pattern? So you're going to see hilar and mediastinal lymphadenopathy with or without pneumonia. Adenopathy may cause tracheobronchial airway compression leading to segmental or lobar collapse, especially of the middle lobe. So these are pneumonic consolidations. So basically the consolidation that starts off on the lung, that's the gone focus. Then we know that this lymphadenopathy commonly, so a gone focus plus lymphadenopathy leads to a gone complex. Then if the gone complex calcifies, then we then call it complex. And cavitation is rare in primary TB. You need to take note of this. Cavitation is very common. It's actually the hallmark of post-primary TB, but it's rare in primary tuberculosis. Then one thing I need to know is primary TB may also present as empyema, pleural effusion, miliary shadowing, spontaneous bronchopleural fistula with hydropneumothorax or pericardial effusion. So let's look at the diagram here. So I hope you're able to see adenopathy here. Then this is basically a gone complex. So remember what a gone complex was? That was gone focus plus lymphadenopathy. Then if we talk about post-primary TB, so the radiographic pattern, there'll be patchy bronchopneumonia. Usually the consolidation is restricted inside, commonly occurring in the upper lobes or apical segments of the lower lobes. However, there may be bronchopneumonia spread and nodular shadowing occurring anywhere in the lungs. Cavitation is common and a hallmark of the disease. Usually there is no adenopathy. So remember in primary we usually have adenopathy and rarely cavitations. However, in post-primary cavitations are common and adenopathy is not really there. There may be volume loss and fibrosis occurring along with cavitation, may present as an effusion or empyema in young adults or pneumothorax due to a ruptured focus. Miliary shadowing, so that's basically discrete 1 to 2 millimeters nodule distributed evenly throughout the lungs. Then you also need to take notice as healing progresses, features which may be recognized are fibrosis and volume loss, shrinkage, may be calcified foci, tuberculoma, which is a localized granuloma, often containing calcification and pleural calcification. So let's discuss this diagram. This chest x-ray showing post-primary TB. So one thing that I really wanted you guys to take note is the patchy bronchopneumonia. Are you able to see this? Patchy consolidations. Yes, and the other important thing I want to show you is the cavitations. So if you're able to appreciate there's a cavity here, then there's another cavity here, and another one on top. So remember cavitation is common in post-primary TB. So once you look at a chest X-ray and you notice this cavitation,